Depression is really real, with pregnancy and stuff, so having somebody else along your side and making sure it's okay to say you need help, you're still a human being at the end of the day. Group centering is very important because everybody is there that has problems too, that has situations too, and y'all can talk about it as a group.
Relationship is a big thing that is missing in a lot of our interactions with our community members. In group care, when you have your baby, you have familiar faces. You get called by your first name.
Group care is a way to, I think, first and foremost, build community. Patients come in and they're like, what is this? I don't know if I feel comfortable. Who are all these other people? How is this gonna work? And then each group, they get a little bit more comfortable. And by the end of it, they are just like such good friends.
When you're comfortable with someone and you're in a more familiar environment and a more familial environment, then you become more comfortable asking for assistance that you otherwise may not have.
The beauty of group is just everything that a woman needs to be well. We actually have been through a lot of similar situations that these ladies have been through, so just kind of meeting people where they're at, not being judgmental, and making them feel very comfortable.
We have a mental health coordinator who comes in for 2 sessions. She goes over postpartum depression, baby blues. We have resources for lactation consultants. We have connections to resources throughout the community to help with things like food and housing. And I think patients figure out pretty quickly that we're really on their side and we have a lot to offer them.
One of the reasons for group care is to lower infant mortality. And it has been proven statistically that moms that participate in group care models during their prenatal care, they have lower risks. As far as your clinical care, your medical care, all those things are still the same. They're still top notch. There's nothing missing there. But it gives your provider an opportunity to get to know you. You have an opportunity to get to know your provider. The more you know, the better you can do, the better you can advocate for yourself.
We don't see ourselves as like experts. We see ourselves as fellow moms who just happen to be leading the group in the direction that it's going. And I think that we create a space for our centering moms where they feel like they're coming to visit like beloved family. What we see with that is better outcomes because moms who are emotionally prepared for labor and delivery and for, parenting babies and young children are going to be better moms, and the babies are going to be better attached, and moms are going to enjoy parenting even more.
I've done centering for years and years and years, and I've had very few patients that have come to centering and decided that they didn't like it. The vast majority of patients who come to centering are in the end so thankful that they did, just because they learn so much more. They feel like they understand what's happening to them during pregnancy and during labor and during postpartum.
People think it's just a parenting group. No, it's not. It's really a group of people that's there for you, that don't judge you, that doesn't, really care about what your flaws is. They're there to help you.
I think the more that we talk about things like this and the more we educate women, they have no choice but to do better because they know better. And that's just what we do as humans. I think this is where it's at.
I've never had this sort of thing happen to me before, but I do love to be around these other ladies. I honestly do. I would just say, go to centering. Give it a try.